China has identified the cause of the mysterious pneumonia outbreak in Wuhan city, and it's from the same family that caused the deadly SARS epidemic 17 years ago. It is a new type of coronavirus. The World Health Organization believes the discovery will help authorities around the world detect and respond to outbreaks. And for more on this, we have Dr. Piotr Chlebicki from the Infectious Diseases Medical Clinic at Mount Alvernia Hospital joining us in studio.
Dr. Chlebicki, very welcome to the studio. Thank you for coming in. Now, where we've got so far is we know that the pneumonia outbreak is linked to this new type of coronavirus in the same family as SARS and MERS. Does that concern you?
It's a very common type of viruses, and quite a few species in this family cause common respiratory tract infections. We obviously are well aware that SARS and MERS is caused by coronaviruses, so obviously this has a potential for a spread, but so far we have heard quite optimistic news coming from Wuhan.
All right, so
China.
How serious is this outbreak though?
So right now it's about a month from the first case, and we still don't have any fatalities, and we already know the cause of this infection. So I am actually quite impressed by the response in Wuhan, and I think right now early news suggests that it's not as serious as SARS or MERS. It's early days, but so far it looks like it's less serious.
Less serious because of the kind of virus it is, or less serious because we've had the experience from SARS and MERS, and there are health measures in place?
A few reasons. It's a month into this outbreak and we still don't have any fatality. It's a month into the outbreak and we still don't have human-to-human transmission. And it's a month to this outbreak and we already have such an impressive response from health authorities in Wuhan. So I think taken all together, we are now better prepared to handle such situations.
Okay, so what is next? What are the next steps, though? Because now that we know it comes from the same family as SARS and MERS, will they be able to, I mean, this is too far-fetched to find a cure for it, but help in the recovery process?
So the next thing that we would really like to see is the rapid test to identify this virus. Right now we have these patients coming to the hospitals with symptoms that are common for multiple respiratory infections. We would like to quickly identify that we are dealing with Wuhan coronavirus. That such tests are molecular tests called PCR tests, and Chinese health authorities are in a unique position to produce such tests quickly for us and for other healthcare facilities in China. And that, I think, would be the major step. It is very important to identify these patients early.
Right, and with Chinese New Year approaching, there's going to be a huge movement of people across the regions. What would you say to the countries in China and around China who might expect this flow of traffic? How should they be working together?
The coronavirus is spread through respiratory route, so obviously when we will see hundreds of millions of people on the move, on trains, on buses, in airplanes, there is a potential for spread. Now, right now it's very early on. Unfortunately, Chinese New Year is just 2 weeks away, and it's unlikely that we will know much more by the time it starts. Hopefully we will have better understanding, but 2 weeks is quite a short period. It's important to follow usual precautions. If you are not well, stay at home, contact doctors quickly, and if you are sick after a trip to Wuhan, please come to one of our hospitals.
Right. All right, many thanks, Dr. Piotr Chlebicki, for that advice and giving us some of your take on this Wuhan virus.